Good evening. I'm back again this evening for #Fertility Expert Live. Tonight I'm going to be joined by the lovely Dr Despina Mavridou from the Women's Wellness Centre in Chelsea, London. And we're going to be talking about lots of things. We're going to be talking about unexplained infertility. We're going to be talking about fibroids and fertility. And we're also going to be talking about endometriosis. So we've got something exciting to share at the end of the session. So bear with us. Dr Despina will be joining any minute now. I'm just going to see if she's there yet. And please interrupt and ask any questions for her as we're chatting, because they're very meaty topics, and we've had lots of requests for people to hear more about them, hence the live tonight. She has just written a very, very resourceful article all about PCOS. Now, what I like about it is the fact that it's very digestible and easy to understand. So if you go to the Fertility Help Hub website, the link is in the bio, then you can click on that and you'll be able to read all about symptoms, how it's treated, and weight gain, weight loss, that kind of thing. So check that out on PCOS on our website. I'm just waiting for the connection now. So hi to those who are joining, thank you. And please do ask any questions once Dr Mavridou is here. Sometimes it takes a little time for the connection to work, so let's see what happens. Let's see, it just says that it's waiting. In the meantime, definitely go and check out the PCOS article that I just told you about. Right, I like the fact that Dr Despina was in her scrubs earlier, so that she was actually on call, which meant that she has finished her day now, so she's joining us after a day's work. And here she is. Good evening.
Oh, hello.
I was just saying that you sent over a video about this evening in your scrubs.
Yeah.
So how was your day today?
Yeah, it was really good. I was on call on labor ward today. So yeah, it was very busy, training lots of juniors. Yeah, keep the adrenaline rush going. That's for sure.
Brilliant, brilliant. So I've just done an introduction about what we're going to be speaking about tonight.
Yeah.
For those who are joining, we're going to be talking about endometriosis, fibroids and fertility, and also unexplained infertility. So do you want to just introduce yourself? I know we had a conversation maybe a couple of weeks or months ago now. Lockdown is a bit crazy. But if you could reintroduce yourself, please, then we can go from there and take people's questions.
Yeah. So I'm a fertility specialist at the Women's Wellness Centre. And I have Yes.
Yeah.
And I have a background of laparoscopic and hysteroscopic surgery in terms of fertility, and also the IVF, ICSI, IUI for that as well. And I think the connection is not very good.
Oh, no, it's fine. We're here. I'm here.
Okay. Yeah. And yes. So, and also in the NHS, I am a fertility lead in the fertility services.
Great.
Consultant.
Perfect. Thank you for the intro. So the first topic, should we start with fibroids and fertility?
Yes, we can start fibroids. So fibroids, it's very difficult to explain like that. So I've got a nice picture to show you.
Please.
So 3 types of fibroids, okay? It's very, can you see?
Not hugely well. A bit, but we can see the diagram, but we can't see the labels, or I can't.
No, you don't need to worry about the labels. I will explain to you. So this big fibroid here is the one type of fibroid that it sticks out, as you can see, sticks out of the womb. So this is the womb here, and this is the inside. And normally this is where the embryo will implant in this kind of in here, in the lining. So fertilization occurs here in the tube, and then it drops down, the embryo is implanted here. So this fibroid, this is a subserosal fibroid, which is kind of sticks out here, and it can stick out here. The second fibroid is in the muscle of the womb. So the muscle of the womb is here, this kind of orangey, light orange bit.
Okay.
Yeah. So this is the outside of the womb, and this is the inside of the womb. And in between, this is the muscle of the womb, and this is the fibroid. So fibroids basically are like fibrous, very thick tissue. Yeah. It's almost like a cartilage, if I was to explain it, but not as hard, a little bit less than that. So this is the kind of the consistency, how they feel. And then this is the second type of fibroid here. Yeah, in the muscle. And then the third kind of type of fibroid is the subserosal, submucous, which is in the mucus part of the cavity.
Okay.
So in terms of fertility, these ones that are stick out in here, and if you can see here, is pressing in the cavity of the womb. These are affecting subfertility. Okay. Now, there's been some studies that the fibroids that are here in the muscle, they do affect IVF as well. And that in terms of sizes as well, if they're quite big, even though if they don't push inside the womb, inside the cavity, and if they're kind of decent size, then they can still affect subfertility. Eloise, I can't see you very well.
Oh,
but never mind.
I can see you. So,
okay, that's good.
So how do people know that they have a fibroid or fibroids, and how is it treated?
So you have a scan, ultrasound scan, and you can have a high COSY, which is also part of a 3D, which is a really great way of looking at them. And the ideal is sometimes you would expand the cavity, expand the inside, and this happens in high COSY because you push a bit of a saline sterile, and then you see beautifully exactly where you map, as we call it, you map the fibroids.
Okay.
The ones that are stick out, they definitely need to be removed. Okay. Usually you would know because usually you would have heavy periods. Okay. So this type of fibroid that sticks out, and this type of fibroid that is in the muscle, they cause heavy periods. Okay. And you have a scan, then you pick them up, and then you organize, and then they're removed. This one that sticks out like that, you know, this one, the submucous, yeah. Yep. They are removed hysteroscopically, which is basically is a little camera, it's a scope like a camera that goes through the neck of the womb, inside from below, and they are shaved, they're shaved off as kind of a way of removing them. Okay.
What about the one on the top?
This one?
Yeah.
This one, if they're really huge, they can affect IVF, but not spontaneous conception.
And why is that?
Because if you think about it, when you do IVF, you go through to extract the eggs from the ovaries, yeah?
Yeah.
And then this can be in the way. Here in the picture, it might not be in the way, but if it's a 3D, if you can imagine the 3D, this is pretty much sitting. Sometimes it's sitting in between here, like here. So when the needle goes through, because the needle goes through here to extract the eggs, to access here, sometimes, so this is the route that the egg collection occurs, then mechanically it can obstruct, then it can be difficult. Okay. Sometimes it might not. So you need the expert to scan you, and then you can tell the route where the needle will go and say, okay, this should be okay or not. But usually fibers as this size, even though they don't obstruct the cavity, the inside, sometimes they need to be removed. Okay.
Has anyone watching felt that they may have fibroids or had treatment for fibroids? It would be really interesting to hear from you if you have, as we talk about these different topics.
So the other thing, Eloise, yes, I just want to finish this one. So basically, it can be hysteroscopically, but also you can laparoscopically remove these ones.
Okay.
These ones here. Okay.
Great. Thank you. That was a very useful diagram. Someone has just said that. And if you do have fibroids and they are removed, does that mean that your fertility resets, if you like? Is there any damage associated with having had them? Or does that mean that you should be able to get pregnant naturally or through IVF, hopefully?
Yeah, so in terms of success rate, definitely it increases your chances of conceiving after removing them. When you remove them, it doesn't have to be, but ideally a fertility specialist with kind of in the background of the fertility is important.
Yeah.
Because we need to know that the cavity, which is the inside of the womb, is disturbed. So we don't want to disturb it too much. We want to remove the fibroids gently without disturbing, and kind of interfering with the layers of the womb. Okay.
Okay.
So that's important. And if some of them can be done laparoscopically, which is the bigger ones, then that can be done. It depends on the size and the position.
Okay.
Now I know in Spain and in some other countries, especially in Spain, and if anyone in fertility world in Spain can watch this, I know that they love removing even the tiny ones in the muscle. For example, this one that you might think that it doesn't disturb, it doesn't do anything. So it depends how invasive you can be and how conservative you can be. Yeah.
Okay, great, thank you.
Okay.
And then maybe we should now move on to endometriosis. Would you say that endometriosis is a more common concern for women over fibroids?
Endometriosis is found in 20 to 40% of couples trying to conceive.
Gosh,
and those, it's really high. Yes, it is high. And usually these are women that come present with unexplained subfertility.
Okay, so they're linked, are they?
Sorry?
They're linked. Unexplained infertility and endometriosis can be linked.
It's linked, yeah. So when you do the basic fertility investigations, whether the ovaries are okay and they're ovulating, the sperm, the tubes are patent, on the scan, ultrasound scan, everything is normal, then you say, okay, this is unexplained subfertility, because endometriosis cannot be diagnosed on ultrasound or any imaging. Endometriosis, you need to do a laparoscopy, which is a keyhole through the belly button, and you have a look in the tummy and you see if there's any endometriosis. So it's history based. So endometriosis presents with the typical symptoms is painful periods, painful sexual intercourse. These are the two main things. And usually is women that always had painful periods. So it's a typical, I've had painful periods and I've been on the pill and I felt really great because I didn't have the pains anymore. And then I stopped the pill because I wanted to try and conceive. And then my period pains came back. So this is a typical picture of endometriosis.
Okay.
Yeah.
Okay. I'm just going to stop you there if you don't mind.
Yes.
Because we just had a question.
Yep.
Friday in the making. I've got endometriosis and now a simple cyst, so IVF had to be halted. Is there anything I can do to speed up getting rid of a simple cyst?
A simple cyst, it depends on the size. So up to 4 centimeters, they resolve. Usually takes a couple of periods to resolve.
Okay.
Usually the NICE guidelines and the guidelines in England, they say that a simple cyst is acceptable to have up to 4 centimeters and you can continue IVF. Of course, it's very difficult to comment because maybe there's something else going on in there. But typically, if it's up to 4 centimeters, it shouldn't delay the IVF because it should be okay. But like I said, we don't know the full picture. It might be something else going on.
Yeah, of course.
So yes, but what to do? Nothing to do. You can't do anything. Just wait, and in a couple of periods, then it will resolve. Yeah.
Cool, thank you. And you were talking about symptoms of endometriosis, and also then going to link it to unexplained infertility. Do some people not get any symptoms at all, and that's why it is unexplained, because it's not until further investigations are done that the endometriosis is revealed?
It's a very good point, Eloise. It's a very good point, because pain is very subjective.
Mm-hmm.
Pain for you might not be pain for me. So painful periods, again, is very relevant. Some women might be just tougher, or just their pain threshold is so much higher, and then you will never know unless you do a laparoscopy. So how do we select, make the selection of who gets laparoscopy and who is not? Usually it's from the history. So there's no standard practice that all women with unexplained subfertility, they should be having laparoscopy and check that.
Okay.
But it's the history, and usually a careful history by a fertility specialist, you could pick up the signs and the symptoms. You can tell from the history, and then you make your selection of who gets laparoscopy or not. And by treating endometriosis, then you increase your chances of spontaneous conception.
Right. And
by 50%.
you say by treating it, is that with surgery?
Yeah. So endometriosis comes in a very simple way of explaining is mild, moderate, or severe. Mild and moderate endometriosis can be treated at laparoscopy by burning it or laser, and it can increase the spontaneous conception rate by 50% 6 months after the laparoscopy.
Okay, gosh, that's quite high. And can the endometriosis come back once it's been treated?
Yeah, so endometriosis, so maybe, shall we go quick? Endometriosis is basically the glands that are supposed to be in the womb are found outside the womb, around in our tummy. So every time we have a period, those little glands are flaring up every time we have a period, and the endometriosis gets progressively worse unless we suppress the periods. Of course, in fertility, we can't suppress the periods because that would be counterproductive. So then when you treat endometriosis, you have the benefit of increased spontaneous conception rate a few months after treating it. So usually we say 4 to 6 months you get the benefit, and then beyond that, if you don't fall pregnant, then that's is unlikely. Does it make sense?
Yeah. And is it hereditary endometriosis?
Endometriosis, okay. Why is a big discussion, endometriosis, of what's causing it? There are a lot of theories. Nobody knows. Some people say that it runs in families. Some theories, I should say. Some studies. Some studies say that is the blood kind of coming out in the pelvis. So from the tubes, flushing is if there's kind of pressure in the womb, and then it goes back. Or sometimes they say that, which I think this is the most likely explanation, is some like enzymes or factors in our body that encourage endometriosis outside the womb.
Okay.
It's very difficult to explain. It's like those factors are similar, not the same as cancer factors, because they form little new blood vessels, nothing like cancer, but it's the same concept that those are found outside the womb.
Okay. And if anyone watching has got endometriosis or suspects they might have it and is concerned about fertility or just their well-being, then please do send over any questions as we talk. And then also unexplained infertility, or you say subfertility. Why do lots of couples face this? And what does it mean for success rates if that involves IVF as a way to have a child?
Okay, unexplained subfertility is basically after investigations, there's no organic cause for it, kind of obvious cause. You confirm that the ovulation occurs, the sperm is normal, the tubes are patent. Of course, you never know what happens, why when the egg is released is not moving into the tube, into the pipe that would where the fertilization occurs. We don't know if that happens or not. We know that the egg is released, but is it receptive? Is it picked up by the tube? We don't know. It's a very frustrating kind of diagnosis for couples because it's very difficult to come to terms with it. And there's been a lot of studies over unexplained because it's a big percentage, 20 to 25% of couples have unexplained subfertility. Now, when it comes to the different ways of kind of treatment, something that is being recent in the recent evidence and is very kind of in the States quite popular, in England not so, is we stimulate the ovaries and we do IUI. So this has been shown the best way of increasing your chances in subfertility if you want to avoid IVF.
Okay. But IUI doesn't have the same success rate as IVF, is that correct?
No. So IUI is 10 to 15% success rate per cycle, and IVF is 40%. Now,
depending on age and things like that.
Yes, so it depends. So for example, I would say for a woman less than 35 years old or less than 37 years old, I would discuss the possibility of stimulating the ovary and then doing an IUI, because the IUI is less invasive, is cheaper, and I mean, it's much less invasive than IVF. And it can give you a really good, I mean, 15% is quite good in terms of doing it a few cycles. So if you do 3-4 cycles, you have the cumulative success rate as an IVF.
Yes. Yeah.
And is less invasive. IVF is definitely a way to go in terms of, one go is 40% success rate, and then you have the embryos preserved. And again, I mean, this is a discussion that it can be individualized, because you can say the pros and cons, but again, it depends on the couple, it depends on the age, it depends on the duration of fertility, and it depends whether it's primary or secondary. So if they had a child before, or if you've never been pregnant before.
Yeah. Okay. And would you say that sometimes for some people IUI can suit their body, because we know that for some people the body may not be as receptive to IVF as it might be with natural conception, or for example, embryologists talk about sometimes putting day 3 embryos back in the womb, don't they, for possibly a better chance of making it into a blastocyst stage inside the body rather than in a lab.
Yes, that's correct. And I mean, it's been shown that couples that had failed IVF, they have 25% chance of even spontaneous conception sometimes. And also it can be up to 50% to that. So it depends, but definitely it depends on the female and on the individual, on the duration of fertility and what they've tried. And also when you've tried the IVF, on the outcome of the IVF, what come out of it, what the embryos are like, or what's happened. Is it the implantation, or it's variables? But I would say that IUI is a good is a good option in women that are less than 37 years old, and there's primary or secondary subfertility with a stimulation of ovaries. So you can give Clomid, and then you can do the IUI in that way, kind of. Yeah.
If anyone's got any questions, please shoot them across. I was doing a live actually a couple of days ago with a nutritionist in Australia, and we were talking about endometriosis and other things, and how diet can impact that, and supplements and things like that. So from a medical standpoint, what's your take on treating some of these things with a holistic approach, including nutrition and supplements?
In terms of endometriosis and the pain, it can be debilitating, and it can be really, especially in endometriosis and especially in severe cases. So in general, from experience with patients, you can see a huge difference when the lifestyle is healthier in terms of exercise, diet, how you cope with the pain. It makes a huge difference. Now, when it comes to fertility, whether it increases the chances, I always believe that a healthier lifestyle, irrelevant of having endometriosis, definitely increases your chances of conception. And I am a great believer of that. I think, diet is great. There's no specific food, supplement, or any requirement that is directly associated with decreasing or increasing endometriosis rates. But I think it's always a way to how to cope with the pain, because the pain is really devastating in women with endometriosis.
Yeah, absolutely. Does it improve once you've had surgery?
So the endometriosis, the pain improves when you laser it and when you remove it for a few months, and then it takes a few months for it to flare up again.
Okay.
And usually, if fertility is not an issue, we suppress the endometriosis with the pill, because then it suppresses the pill. Now, I just wanted to clarify that endometriosis does not affect the IVF success rate.
Okay, that's good to know.
Yes. The only thing that can affect, I think I saw one in the comments earlier, endometrioma. Endometrioma is endometriosis in the ovary. So you can have the little spots anywhere in the tummy, but when there is present in the ovary, then you have the endometrioma. So the endometrioma is a cyst filled with ovarian cyst filled with chocolate-like fluid. That's what we call it in the even in the medical term. Is it chocolate cyst, because it actually looks exactly like a chocolate. I don't want to put anyone off from having chocolate.
I know if anyone's eating now, they're probably not feeling good.
Hot chocolate, sorry. And that ideally is good to be removed before having IVF, because it occupies precious ovarian tissue that can potentially be stimulated, and you can get follicles out of it.
Right.
So usually, like I said earlier, again, the cutoff in England is 4 centimeters or less is okay to go ahead and have IVF. But I think, in my opinion, ideally, it's good to remove it, because it can get bigger during IVF. Again, it has to be by someone that has fertility as an interest, so they can do the minimal and gentle removal of the cyst without disturbing the ovarian tissue, which is quite precious.
Okay.
Yeah.
And for people who are in the UK, is this done privately? Is this done on the NHS? Is there a mixture of it?
Both, yes. It can be done both. It can be done privately at the Women's Wellness Centre, and at the NHS. We can do it. In the NHS, it would be part of the you need to be referred, as we all know, by a GP. And so
it's probably quicker, isn't it, to have it done privately?
Yes, I mean, especially, yes, it's especially now with COVID, that all the elective lists are stopped. The waiting list is probably 6 months to begin with.
Wow.
So, yeah.
How whilst we're talking about clinics reopening, how is everything at the Women's Wellness Centre?
Well, Women's Wellness Centre is all back in full, Monday to Friday.
Yeah.
And we've been actually getting quite busy, which is really good. And we have the swab. We can do the swab, the COVID swab, and the antibody test, depending on whether you think you had it or no symptoms, you do the antibody, or if there are any symptoms, then we can do the swab.
Great.
And at the time, yes. So that's what's happening now.
Brilliant, thank you. I just want to say at this point that if anyone is in the UK and wants to have treatment for any of the above or more, or even just to have a chat with Despina, then the Women's Wellness are generously offering £50 off a consult and a scan for the first 5 people who sign up for a consult with Dr. Despina that are Fertility Help Hub readers or members. So if you would like to speak to her for a consult and scan, then do message me or message them directly, and we can get it booked for you as soon as possible. Someone has just said, this is a bit off the what we were talking about, but 21, is that too young for IVF?
No, it's not too young for IVF. There's no, it's not too young. But I would think that how long have they been trying and what's the reason? I mean, if it's male factor, then of course, why not? No, it's not. It's not. If you want to have a child, then of course.
It's a very interesting question, because normally the question is, am I too old for IVF? So it's, it's interesting to hear people requiring it or looking into it at a younger age.
21, yeah. I mean, that's, I think, and I'm a big advocate of planning your life and fertility preservation if you can. And that's, I think that's very important to plan. That's very good. Very mature 21-year-old.
Yeah, I agree. And lastly, if anyone feels that they have PCOS or wants to know more about it, then you've written a very, very insightful, probably the best PCOS article I've seen.
Thank you, Louise.
Very, very easy to digest and understand, all about how it's diagnosed, how it can affect fertility, how it can be treated, lifestyle, weight, all sorts of things, which we have questions about all the time. So thank you for that. And if anyone wants to check it out, then go to the link in the bio on the website, on the Fertility Help Hub profile. You can also contact Despina through there directly if you do want to benefit from the £50 off the consult and scan. So someone has just said, I'd like a consultation. Who do I message? If you message me just at Fertility Help Hub, I can pass it on for you, and we can get that sorted. So yeah, drop me a message. Alicia has just said, been trying for over a year. Sorry, this is back to 21 years old. Had 1 ovary removed and 2 cycles of egg freezing last year, but feels so ready to become a mother. Thank you for your advice.
I think that's amazing. Egg freezing. I think for a woman to have the courage to go and have egg preservation, I think that's just amazing. I think it's just something that technology now and the ability to have that is just great. I think it gives you the option.
Yeah.
And that option is there, and it's great. I think it's just amazing. I've given a talk to the trainees. I'm like a mom to the trainees, saying to them, yes, we need to empower our rights and just be more proactive, and then go for it if that's what we need to do. Because not even the obs and gynae trainees or even the medical students are aware of the decreasing fertility as we grow older. And I think that's something important. And yeah, definitely egg freezing, yay.
I think, yeah, I say this a lot, but I think there should be more education about it in secondary school, because you're always taught how not to get pregnant.
Yeah, exactly. And this is what actually a colleague of mine we will start doing in terms of secondary. After my talk on Friday, she's like, "Can you come and speak to my daughter's school, please?" It's like, "Yeah, okay." So I think it's something that it has to be from secondary school, because then you need to know in terms of career and what you get into. That's all really.
Tash, I'll send you a message. Sorry, I've just seen you're interested in a potential consult and scan, so I'll send you a message as well. Was there anything else you wanted to add, Despina?
I think in terms of unexplained subfertility, it's something that I think it hasn't been very. I don't see many couples asking about IUI. Most couples, they would like to go straight for IVF. And of course, IVF gives you the highest success rate in one go. But we all know that IVF is quite stressful, is quite invasive. And of course, it depends on the history. But I think, or sometimes even awaiting for an IVF, or if you want to give yourself another year, depending on the age, then IUI with ovarian stimulation, it's really a great one. And we'll be starting very soon to be doing it at the Women's Wellness Center, the IUI.
Amazing.
Yes.
Amazing. It's such a beautiful clinic.
Yes.
I personally had scans there, so I know how great it is. Well, thank you so much. And oh, she said, yeah, good. Okay.
32. So I'm just reading it. Sorry, I'm getting very excited about eggs. 32 eggs. That's amazing.
Wow.
So that's at the age of, how old are you? I don't know how old.
I think Alicia said she was 21.
Oh, she's the same person. So you have 95% chance of a live birth rate when you do want to have a baby. So there you go.
Wow. Wow, that's very reassuring to hear. Thank you, as always, Despina. It's lovely chatting with you, for all your knowledge, expertise, and yeah, speciality with the topics we've been discussing tonight and more. And do check out the PCOS article on the website, and we'll speak to you soon. So thank you very much, everyone, for joining.